Hello, my name is Nicole Chávez Nerio. I'm a doctor, and in this video I talk about a very important medical specialty. I'm a doctor specialized in nephrology. In this video I talk about my journey to become a nephrologist and some facts about the specialty. So if you're a medicine student, you maybe will be interested, and maybe you will know if you want to become a nephrologist like me. So if now you're wondering, where did I my specialization and how much time did it take me? Well, first I studied general medicine and the National University of El Salvador. It took me 8 years. Then, in the last 2 years of my doctorate in medicine, I was so confused and I was worried about what should I do when I graduate. What especially should I choose, because it's a really important decision to make. It's not easy. So you have to choose something that you will be working in and the rest of your career. So, and in my internship, I took the decision to specialize in nephrology. For my specialty, it didn't require a certain level of English, but if you do your specialty in another country like the United States, for example, you have to be a B2 level of English, because you have to be able to communicate with your patients and with your colleagues. If you don't know what nephrology as a specialty is about, well, basically, I am dedicated to the study and management to all kind of kidney-related diseases and conditions. And what this means? Well, basically, kidney stones, for example, electrolyte imbalances, hypertension, diabetes, and all these kind of diseases related to the kidneys and its anatomy. So I, as a nephrologist, I do not only care for the really sick patients, but the prevention, diagnosis, and treatment of this. And it's hard to see that people who are really need to see nephrology, and they don't go to the doctor because they don't have the resources, they don't have the money to go, and it's really hard for it can go to a really hard condition, and maybe some go to the last stage of chronic kidney diseases, like they need dialysis and this kind of thing. Here we can see some instruments that are usually used in nephrology. For example, first we have the ultrasound machines for renal imaging, and next all the laboratory tests, including serum creatinine, urine panels in studies, and electrolyte panels. If last we have the dialysis machines, this for patients who suffer end-stage renal disease. If you don't know when are you supposed to go to the nephrology, well, if you present some of these symptoms, means that you need to go to the nephrologist, because it can mean that you're suffering maybe a kidney related disease. For example, if you notice changes in your urine usual color, or if you notice the presence of blood or proteins in your urine, you need to go to the nephrology. If you feel any pain in the lower part of your back, then it can mean that you're suffering maybe a kidney related disease or an infection. Some commonly prescribed medications are antihypertensives such as ACE inhibitors and ARBs for management hypertension and preserving renal function. We have the diuretics for fluid and electrolyte management in conditions like heart failure and edema. Then we have the immunosuppressants to prevent rejection in kidney transplant recipients. Then we have the erythropoiesis stimulating agents (ESA) for anemia management for in chronic kidney disease. And last, we have the phosphatidylcholine and vitamin D analogs for management mineral and bone disorders in chronic kidney disease. I can recall a patient who presented with advanced chronic kidney disease due to uncontrolled diabetes. Through personalized treatment, including medication management and lifestyle modification, and close monitoring, we manage as a team with others specialists to stabilize his condition and improve his quality of life. Witnessing his progress was immensely rewarding and reaffirmed the importance of individualized care in nephrology. So this was all. Thank you, and I hope that the video helped you or maybe choose your future medical specialty.